All right, Dr. Mark here. We have a dog that is in need of a TPLO. We're positioning it right now, getting it ready for surgery. And I just want to come in and show you what we're looking for whenever we're diagnosing a torn cruciate ligament. So in humans, we call it the ACL. In dogs, we call it the CCL, the cranial cruciate ligament. And what it does, the femur is running here to the knee, which then the tibia is running down to the hock or the ankle. And I put my fingertip on the tibia and I hold the femur, and I'm going to do a test called a tibial thrust. And you're going to see my finger move forward whenever I do that. That movement is not normal when you see that. So that tibial thrust tells me that there is some abnormal movement in the joint. One other test that we do as orthopedic veterinarians is we do what's called a drawer sign. And what that is we see the translation of the femur to the tibia, and this is another sign that we have a CCL or ACL tear in a dog. And so the other thing that we'll see is if we hyperextend the knee, we'll get a lot of pain, so hyperextension pain. Those are three big tests that we do in the exam room to diagnose a cruciate tear. And what I want to do is come over to this other dog's leg, and you'll see, and I'll be on the inside of the leg, that's okay, you'll see that I'm going to do the same tibial thrust, and it doesn't move at all. So this is a stable knee right here, and if we do the drawer, which normally you do it on the outside, but you get no movement here, and then this dog does not have hyperextension pain either. So we're going to go in on the inside of this leg over here, and we're going to do what's called a TPLO. And we're going to take their joint surface, which is about 30 degrees, and I'm going to level it to 0 or right about 0. And so now, and I'll test this tibial thrust. I'll test that to make sure it goes away during surgery. Surgery is complete. We performed a TPLO, and what I want to show is the tibial thrust is now gone. So I'm holding the femur, I have my fingertip on the tibial tuberosity or the point of the tibia, and there is no movement when I try to thrust that tibia. So we have stabilized this knee, good range of motion, nice and stable,